Tricia Jordan was always drawn to medicine. When it was time to choose a college, she decided to stay close to home and head to Howard Community College.
I like small, close-knit, community-style environments in general, and I think that's what drew me to HCC.
Her career path has led her to the Cardiac Catheter Lab at Howard General Hospital.
I really enjoy taking care of people, and now that I'm working in the county where I grew up, it's very, I feel really good about giving back to my community and getting to know the people that live where I live and taking care of them.
Caring for the community has been a big part of HCC's healthcare programs since the very beginning.
The mission has always been to prepare entry-level associate degree nursing students who are prepared to meet the demands of the workforce. Even when the program started back in 1972, there was a call for more nurses. And of course, over the years, that call has grown exponentially.
Debbie Slack Katz was part of the first class of nursing students at HCC, and she's seen the program grow into what it is today.
At the time, I was all of 17 years old, and I had just graduated from high school. I was planning to be a nurse. Probably the thing that fascinated me the most, because I think it's in line with the way I think, is the whole integrated approach of the program. And that has carried me far on my journey, to be honest with you, because I can remember some of the early nursing instructors. We didn't even call them professors then, we called them instructors. But some of the early nursing instructors would say, it doesn't matter if you're on the pediatric floor or the adult floor, a blood pressure is a blood pressure. Once you know how to do it, you know how to do it.
Once Debbie graduated, she left for jobs in the Midwest, but eventually she settled back in Howard County.
There's something to me special about the Howard County because this is where my roots are. A lot of people know I'm the 13th generation of my family from this area.
As the needs of the community changed, so did the courses HCC had to offer. The opening of the new Health Sciences building coincided with the addition of 4 new programs: Medical Lab Technician, Physical Therapist Assistant, Diagnostic Medical Sonography, and Dental Hygiene.
All of our allied health programs have simulation capabilities within their individual laboratories. We have focused on using simulation as a safe teaching modality before you go out into the real world.
The chance to work with the newest technology was one of the reasons why Michael Seplack came to HCC. Originally working as a research assistant, he decided to make a career change into dental hygiene.
I was looking around, and just at that time, HCC was about to start their dental hygiene program. And I was like, okay, this works perfectly. I have a couple other degrees, and I've learned that a new school usually has the cutting edge technology, as well as try to be on top of the newest protocols, have the newest and the greatest.
You have to become adept to technology, the kinds of technology, and how to use them. Technology, automation, it's all very huge in healthcare.
As many graduates of HCC have discovered, a degree in a health sciences field can lead to a career outside of clinical work. Debbie Slack Katz went on to work on health policy.
One of the things that I learned early on in my career, and one of the things I've taken full advantage of in my career, is that being a nurse just doesn't mean that I'm working at somebody's bedside doing direct care. The thing that has been so significant to me as a nurse is the vehicle and the platform that it's given me to do so much more with my career.
And through those careers, the HCC graduates value their work in the community.
I grew up in a family that community service was very important. And as long as you had a sandwich, you could split it a couple different ways, so everybody could eat. So it was something that I value, and I value to this day.
It's rewarding that you really sometimes get to see certain patients develop, and you've gotten to be able to help them with that.
It's kind of like you have to start somewhere, and why not start where you live and then try to expand further into that. So that's a huge thing for me. And I definitely enjoy serving the people in my community.